Jamie Risse loves spending time outdoors at her home near Lake Madison. It's a place where she can relax and unwind. But back in 2020, she received news that changed her life.
Every January, I'm just like clockwork, going for my mammogram. So I went in that morning and I don't know, I just didn't feel right that day. I thought something was really bothering me or something was wrong. So I went and I did my mammogram and came out, and I got a call that afternoon that they needed to redo it.
After tests, she found out she had intraductal carcinoma and would have a double mastectomy.
Went in and had my surgery, and what they call, it was removal of the cancer, and then they insert the implants by the plastic surgeon. All of that was done. I came out of recovery. Everything was great. Started having my implants filled with the actual solution I'd have to come in and do. And so once I had my actual implants put in, it was probably not even 7-8 months I had to go back in because they were going on my stitch line and making it break open to the point that it could come out.
Eventually, Jamie met with Dr. Figura, a plastic and reconstructive surgeon, who suggested she try microvascular breast reconstruction.
Microvascular surgery is where we disconnect the artery and usually a couple of veins for a portion of tissue that we're going to move from one location to another. And then the microvascular part comes in where we sew those blood vessels together to a recipient vessel at the site where we're going to place the tissue. So a lot of that work's done under the microscope.
At that time, the surgery wasn't offered at Avera. But Dr. Figura and Dr. Jason Fowler, who is also a plastic and reconstructive surgeon, helped bring this option to Avera.
So I really wanted to be able to offer all types of breast reconstruction here at Avera. We have a really exceptional breast program. We're very focused on trying to provide everything that each individual patient needs. And this was the final step.
We talked to administration and we talked to nursing and the OR and looked at, is this a feasible thing that we can do here? But a lot of it started just for passion for caring for patients. Keep them home, keep them where they want to be. We had the technical expertise to do it, the technical experience to do it, and we just needed to make sure that we had the support from the institution to do a really good job.
That led to Jamie being one of the first patients to have this procedure done at Avera.
Day of surgery, I guess I was 15 hours in the OR, which I guess was pretty crazy. I did fine. I felt bad for my husband and my kids because they had to go through all that. But there again, that's where those surgeons came out because they had to take a break here and there. And they came out and they checked on my family and talked to them and said how things were going.
The surgery takes skin from the legs or stomach and connects it to the chest.
Almost any patient is a potential candidate, but they need to have a good donor site. But most women, especially women who develop breast cancer, which is what we're talking about today, are typically mothers. They have extra tissue in their abdomen that they would just love to get rid of. And so it's a nice marriage of a patient who needs to have tissue brought up to their breasts and they really want to have tissue removed from their abdomen.
Jamie is happy with her outcome after surgery and is now able to feel comfortable again and enjoy making memories in her happy place.
This is cool. There's 2 surgeons in Sioux Falls that are willing to do this to help women feel whole again, if they can't have implants or if whatever the reasoning is, it's just it's a comforting feeling.
All while staying close to home.
Being close to home is important. When you're going through something, and it can be anything from a stroke with a family member to breast cancer with someone, having the ability to, go home and sleep in your own bed, having the ability to have a family member that's often near where you live, not always, but usually, not being in a strange place, it's good for the patient. It's good for recovery.
With your Avera Medical Minute, I'm Sarah McDonald.